Kirkland, and in this video I'm going to be presenting a physical exam on a canine patient. So the first thing I'm going to do is I'm going to start up here at our patient's nose. I'm going to check our oral cavity. I see we've got about a periodontal disease, about a level 1. We've got some buildup of plaque and calculus on our teeth. Our mucous membranes are nice and moist, glossy, and our CRT, capillary refill time, is less than 2 seconds or less, I should say. I'm gonna look at our eyes to see if we have any abnormalities. Looking clear. We're checking our ears next. There's a little debris in our left one, AS, and our right one, AD, looks nice and clear. I'm gonna go down our body now. We're just looking for any masses, any abnormalities, as in skin issues, other concerning things like that. So we're just checking head to toe now. We already know we are missing our left pelvic limb from our previous amputation. Good job. We're just checking our rectal area to make sure that everything looks clear and looking normal back there as well. Great job. Next thing we're gonna do is take we're gonna listen here to our heart. We're gonna get a pulse rate and we're gonna see if it's synchronous. We're gonna get a heart rate and we're gonna see if it's synchronous with our pulse rate to see if they're matching at this point. So I'm listening to our heart. Good boy. We're a little worked up, a little nervous. Good boy. I'm feeling our femoral pulse now, and we're seeing if those two are synchronous, pulse and heart rate, which they are, and our femoral pulse is nice and strong as well. Good boy. Next thing I'm gonna do is listen to our lungs. We're gonna see if we hear anything abnormal there. You're doing so good. Stay right there, buddy. Good boy. Sound nice and clear, no wheezing. Listen this side one more time. No crackles. Nice and clear. Good boy. There we go. Heart rate's about 120. Next thing I'm gonna do is count for our respiration rate. We're a little shaky. We're right around 16 right now. Good boy, you're doing so good. The last thing we're gonna do is at ear temperature. Sometimes when you're by yourself, it's harder to do a rectal temperature, or the patients don't necessarily always like it. In this case, something like an ear temperature, ear thermometer comes in handy. When you're using a regular rectal thermometer, you will have to adjust that temperature up 1 degree. But in this case of the ear thermometer, you don't need to make any additional adjustments. Good boy, you're doing so good. Perfect, and our temp is 99.7 there. So we are at normal temp. Everything else looking great. We're gonna make those medical notes in our medical record for the doctor now, and then our patient is ready for a physical exam with the veterinarian. Thank you.